Garments in general are very important after surgery. And bras after breast surgery are very important. The question is, what is the ideal bra? Whether it's for a breast augmentation, a breast reduction, a breast lift, or a combination of the above. What is the ideal bra? And what are the characteristics of an ideal bra? In general, it helps to have a bra that opens in the front. That just makes things a little bit easier. It also helps to have adjustable shoulder straps. For example, these ones here are adjustable. You can adjust it. Now, it's so important to have the straps adjusted evenly, especially if you have an implant, because if you have an implant on either side and you've got one strap much tighter compared to the other one, this implant will be pulled upwards. And of course, that can damage or that can ruin the result. So it's so important when you're putting on a bra to make sure that the straps are actually held together evenly on both sides. It's also important for the bra to have a really good, even support. When you have implants, for example, and this is specifically true for implants, and especially implants that are above the muscle, these implants, they kind of want to come down. You know what I mean? You know, there's nothing holding them. At least when the implants are under the muscle is holding it. But when the implants are above the muscle, if it's not being held properly, they will with time come down because they're quite heavy. So you really need an implant that has a really good support. And I often recommend to my patients, when the implants are above the muscle, to wear a surgical bra for at least 6 months, day and night. So we talked about having the straps evenly on either side. We talked about having good support. The third thing is, and I think this is really important, is when you have a bra, you have to make sure it's comfortable. For example, if you're wearing a bra and it's too tight, and imagining you're wearing it day and night, at some point, this can dig into your skin. So I often tell patients, if you're feeling it's too tight and you're feeling it's digging into the skin, you can always put a little bit of gauze or something here to soften that, or you can even put on a t-shirt or something under it. But you have to protect your skin from a very tight garment, and that's really, really important, you know? When you have a drain in, and I think this is a really important point, it's nice to have a hook here where the drains can attach, but actually the drains can also attach on a regular bra somewhere else. It doesn't have to have a hook, but this is helpful to have a little hook here. Now, an important point when it comes to drains and the bra, that behind the drain, the skin is protected, because you can imagine if you have a very tight bra that's pressing this drain onto the skin, you could get a blister here and it could leave a mark. So I often put a piece of gauze underneath to sort of protect the skin from the drain. This is important actually for all garments, is that if you're going to have a drain there, whether it's a bra, whether it's a body garment, the area where the drain should not be touching the skin at any point, because it can create blisters and leave marks. So to summarize it, the hallmarks of a good bra are to have it open from the front, to have adjustable straps and be very careful to make sure that they're evenly placed, to have very good support, and to have an area where you can attach the drain onto it if necessary.